Yeah, strong will to empower people, to promote the peace, though. Positive attitudes, baby, that's a lifelong dream goal. Yeah, health matters and we're here to help you become the better you, to be the best you, the best version you can be. Yeah, and it's time for this classic, fantastic, food for your soul. It's Jackie and Coach Patrick right here, let's go. Health matters to me. Good morning, guys. You are live here with Help Matters with Jackie
and Coach Patrick.
Guys, thank you for waking up with us this morning, guys. You are listening to WAAW Shout 94.7, the voice of the gospel truth.
This is an awesome day the Lord has made, and
we're going to choose to rejoice and be glad in it, guys.
Yes.
Yes, so much to be grateful.
I love the Lord. I love the Lord.
So much to be grateful for. So much to be thankful for, so much to be appreciated for.
That's right.
You know, because you woke up this morning on this side, you know, God yet kept you another day, sustained you and preserved you and gave you breath this morning. And that's enough to be grateful for. And we should find something every day to be grateful for, no matter whether it's big or whether it's small. Find something to be grateful for, because that's health benefits.
That's right.
You know, your body, respond to things that are positive. So when you think on things that are good and lovely and kind, your body, it feeds off of that. Your cells feeds off of that.
That's right.
And it provides a nourishment to the body, So think on things that are good. Find things that you're grateful for. Some people say, I can't find. Yes, you can. You woke up this morning.
That's it.
If it's nothing but saying, I'm here today.
That's right.
I matter. God chose me today because I woke up on this side, and we have a lot of things going on in our world today, guys. And so we have to stay in prayer. We have to stay in the Word. We have to stay in the presence of God, because it's a lot going on. And we can't make it without him. I was talking to someone yesterday. They said, I don't see how people can make it without God today.
I don't either.
I don't see how they can make it without him, out of his presence. And that's something to think about. That's something to think about. That's something to just ponder on, meditate on. You can't make it without it, because, see, the world is the world. The world is going to do what the world is going to do. But see, God is looking at us. He's looking at us, the ones who is willing to, that if you obey me, and God is looking for his people that is obedient.
Right. It first starts with getting a relationship with him.
Absolutely.
So important that you know him and know that he is the source, he is the strength, he is the joy, of your life. And when you get into that relationship with the Almighty, you'll never turn back to that, that alternative way of living. You won't be conformed to this world. So God is good. He's good all the time. He'll never leave or forsake us. But it starts with a relationship, you believing and confessing that Jesus Christ is Lord and Savior. Well, listen, guys, we were out last Saturday, so it's good to be back in the seat in the studio on this morning live. So thank you, everyone, for tuning in to WAW Shout 94.7 FM on this morning. Those that are coming in on YouTube and Facebook, thank you so much for joining us on this morning. We hope you enjoyed the pre-recorded broadcast on last weekend. September birthdays. I celebrated my birthday on yesterday. Happy birthday, Coach.
Happy birthday.
I enjoyed it. I was with family and grandbabies, so we had a good time and went out and had a birthday dinner. And I really enjoyed just being with family. I had a good time, awesome time. The grandkids had a good time, of course. They always have a good time with their papa.
Oh, yes, definitely. And then they got to compete who's going to sit by him. So we have to arrange things.
Well, usually it's wanting to sit by you. I guess since it was my birthday, they wanted to make me feel good.
Yeah, but the thing is, I was thinking about that on the way up. I said, if you got grandkids, that's a blessing. Enjoy them while you can. Enjoy them while they're young. because they get older, and they start finding their own personality, their own way, and they start kind of
Weaning off.
weaning off you.
Yeah.
They love you, but
Oh yeah.
they just begin to just start blossoming.
Yeah, that's life.
And we have to allow them to do that.
Most definitely.
With some restraint.
Most definitely.
Still, but
well, that's why you train them in the way they should go.
right.
They'll never depart from it.
Yeah, so that's why you enjoy them. So when they're young, so just get all that attention and hugs and everything, while they little, because like I said, once they get older, you know, move mine, hey mom, you want the hug and the kisses you used to get, so
yeah,
I got plenty of videos to remind them of that as they get older.
So it was a good time for my birthday. Those that are celebrating birthdays in this great month of September, happy birthday. Celebrate yourself. Enjoy yourself. Happy anniversary to everyone that you may have jumped the broom, tied the knot, however you did it, and you're becoming one. So happy anniversary if you're celebrating an anniversary in the great month of September. Happy anniversary. Enjoy yourself. Celebrate yourself and continue to create memories and become one. Want to acknowledge our sponsors and partners and friends of the Health Matters broadcast. Dr. Dan, Aiken Chiropractic. When your spine is aligned, your body is too. Aiken Chiropractic is located at 425 Lawrence Street Northwest, right here in Aiken, South Carolina. Their number is 803-641-9191. Their website, www.aikenchiropractic.com. If you would like to be a sponsor, a partner, or a friend of this broadcast, you can call 706-592-8862. We would love for you to help us do what we do. And also, if you want to broaden your advertisement and your visibility out in the CSRA community, there are many opportunities and packages that you can partner with the station here, sponsor the station, sponsor different broadcasts on this station, WAW. There are packages that you can call into the office during the week. That number is 803-649-6405. If you want to make that investment of advertisement for your company, listen, this station reaches many counties, over 16 counties in the CSRA, Georgia and South Carolina. So you would do yourself well to make that investment in your company. Most definitely.
And also, I wanted to piggyback off something. I kind of like this kind of monologue a little bit. Coach went to his game last
yes, sir.
week.
Live.
Yes, live. And
Tuscaloosa, T-Town.
They played Wisconsin, and and connected back with a long lost. I ain't gonna say a long friend.
Army friend. Yeah.
Army friend, and it was such a blessing. It was such a blessing. How you these are the people that you don't talk to as often. But when you come back together, it's like nothing lost.
Yeah, like we've been together forever.
Yeah, like we talk every day, So it's amazing. So
we had a good time.
We have a great story, especially me and Dee. We couldn't stand each other. We could not stand each other, but I wouldn't trade it.
I think it was more you not standing him.
I couldn't. We gonna get into that story.
But yeah, that's my
relationship.
That's my brother from another mother.
Yes,
listen, absolutely. Guys. On Sunday, October 5th, make sure you mark your calendars, set your reminders. Sunday, October 5th at 4:30 p.m., the Swanee Quintet 86th anniversary at Payne College will be taking place. That's located at 1255 Druid Park in Augusta, Georgia. Going to be featuring a lot of great artists. Doors are going to open at 2 p.m. because there's a pre-show at 3:30 p.m. You don't want to miss all the activities that they got planned for you on that day, Sunday, October 5th. Doors open at 2, pre-show at 2:30. Advance tickets are $45. Tickets at the door are $55, and VIP tickets are $75. If you are interested in going, and you should be, you can call Eddie Baines at 706-294-9692, 706-294-9692, or you can call our very own Sister Mary Harris at 803-761-4763, 803-761-4763, and that's for the Swanee Quintet's 86th anniversary. Man, that's an awesome feat. 86 years of doing what you do. Awesome. Man, that's a blessing. I mean, you touch a lot of generations in 86 years. That's awesome.
86 years.
Yeah,
that's a long time.
And that just shows you that the hand of God is on it.
Yes, yes,
Yeah.
yes. Consistency,
Mm-hmm.
not compromising, staying true to your calling,
Your mantle,
your mantle.
right?
Yeah, right. Your assignment,
Most definitely.
your assignment.
So important.
It's so important, guys, to be in our assignment, be doing what God has called us to do, and it is the time. It's the set
Mm-hmm.
time right now, to reset.
Most definitely.
It's the time to
Talking about
get
reset.
back. Yeah, we're talking about that.
Back to church Sundays
Getting
tomorrow.
back to church Sunday is tomorrow. So I don't know if you got you guys church are hosting back to church Sunday. I think a lot of people are, and some people going back to their home churches and back to church. But we at Restoration Ministry International, under the leadership of Dr. Michael Mitchell and First Lady Benita Mitchell, we are having back to church Sunday.
Back to church
back
Sunday.
to church Sunday, guys.
Yeah.
Come on back.
Time to come back.
Come on back. Come on back
Yeah.
to the gathering.
Yes. A lot of people, Jack, has been out of church. The church building anyway. I mean, we the people
we
are the church.
It's
but
where we gather.
people have been out of the gathering place since COVID.
Right.
There are so many options. I think that we're giving. God allowed it during that season for us to still be able to gather. But it's time to come back to church.
Yeah,
I just believe that that's just Coach saying. I believe that it's time to come back
Don't
to church.
forsake yourself for the assembling together.
Right.
Because when things get intense, things get when we already see it. We see it happening, how things is intensifying.
That's why we even more need to assemble.
Yes, and that's what
and do the work of the ministry. Do the work of the ministry
and get on assignment.
Right.
There's an assignment God gave each and every one of us, but it goes back what we said, having that relationship, with Him, so you can connect to your source. To begin to God to reveal that.
And feed others around you,
Yes.
And of course, that don't just take place in the church building, in the gathering. It's outside those four walls, but it's so important for us, to come together, at times and just, just strengthen, strengthen one another. And, also your ability, God has given us talents and gifts and for us to serve, inside the gathering, serve one another. And of course, outside the gathering. But I just feel that it's time to get back to church. The methods that God allowed us to have during pandemic, they were for a purpose and they had their reasonings. And I think it's just time to get back to church. So let's get back to church. Invite some people that that may have not even ever been in the church. Thank God for those people that are bold enough and to invite people to church and spread the gospel of Jesus Christ so that people will want to come to church. And when we get them there, guys, let's treat them like Jesus would treat them. Let's treat them with true compassion, kindness, love, the love of God. Amen? Amen. I heard y'all say amen out there. All right. Praise God. Jack, you want to talk about your book for a minute?
Yes. Coach been having me push this book.
Yes. It's an awesome book. People need to get it.
And I'm not
we
saying
sold
because
some this week.
Yes, we did. We had a help fair this week. Yes, I mean, the book is Still Becoming, A Woman's Journey from Wellness to Wholeness. And it's not only my personal story, but it's a lot of women's story. And, when I embarked on that journey, I had no idea. God was already setting a foundation through Women Owning Wellness. He was setting a foundation. He was building foundation. For the first 7 years, he was building that foundation.
Right. Through your women's ministry.
Through my women health and wellness ministry, he was building a foundation, and I didn't know that.
Right.
And so when I
now let me dig in that a little bit, because you said you didn't know that, because as God gave you themes for these individual women ministry conferences that you did, which was a total of 7, or I think we're on year 8.
Yes.
Yeah. So each theme for each one of those conferences became a chapter in your book.
Yes, it was a chapter, and that was a season. Each one of those chapters was a season I was moving through. And so that's when God spoke to me and told me, your book is finished. That book, start. And I'm like, I haven't written anything.
Right.
God said, yes, He
You
said,
just ain't put it on paper.
it's just, He said, you have, you walked it out. I had to establish it in you
Hmm.
before you were able to help, you know, help others, you know. And it's one thing to, you know, to see people to go, you know, to people to tell you something that, you know, others done been through. But when you done been through it yourself and you have experienced it yourself,
Hmm.
and you're able to be transparent and talk about those things, because
Right.
there's things that I wasn't healed from. God said you look well on the outside, but you wasn't whole internal inside. So that was a thing
Hmm.
that, you know, just got me, and I just bust in tears because
Wow.
I was like, wow, you know, I thought I was good, but I mean, it's not that I didn't have joy, but there was some healing that needed to take place
Hmm.
inside of me. You know, there were some things that I had been holding on to that God was ready for me to release
Right.
out. And so through writing this book, it helped me heal.
That's awesome.
It helped me heal. So, and we moved. You asked me last time what was the meat of it, and I said, I'm coming to become, you know, so mean I'm dying to self, you know, I'm killing flesh. Trust me, I had to die to some flesh.
Mm.
I had to kill it. I had to starve it, you know, because you can't move forward, guys, without changing.
It's,
Change is inevitable.
yes, it is.
It's nothing you can do,
And sometimes it's
and
necessary.
it's necessary for growth. If you're not changing, if you're not growing, something is wrong. You got to, you know. I tell you, you got
Yeah,
to.
you don't want to get stagnant. You don't want to
And
get
when and
comfortable.
you know when you get when you get comfortable, you know is you know and stuff starting happening is
Hmm.
God's trying to push you to another level,
Hmm.
and we fight it.
Hmm.
We fight against it. But if we can, the pain, and it's all flesh, really. It's just flesh refusing.
Hmm.
But if we can allow God to just take us through these seasons in our lives, you know, and mold us,
Right.
because you can't take the old habits into a new level.
Hmm.
You got to get rid of some old habits. You got to get rid of the old way of thinking.
Right. Now, unless those habits are good habits or
Yes,
healthy
old
habits
bad,
that are
yeah,
in
some
line,
bad
yeah,
habits.
that
Some
are
of
in line.
them can
Right.
be adjusted.
Right. They're
Yeah,
modified. Right. But
modified,
we got to
adjusted.
we're gonna keep talking, Jackie.
Yeah.
But our call-in guest this morning is uh, Elizabeth Merritt. She's the Director of Communications for Christ Community Health Services. She's going to be calling in. That's probably her right there. And we're going to have a great conversation with her on this morning.
Yes, guys. So, she, like Coach said, this is Elizabeth Merritt, Director of Development and Communication. You know, so she's going to be talking about their organization and how they serve the community in Augusta. And hi, good morning, caller. Are you on the air? I'm well this morning, and I hope you are well as well.
Thank you. Thank you so much for the invitation.
So, yes, so we're so glad that you took the time out to wake up and call us this morning here on Health Matters on WAAW, because we want people to know what's available to them out there. There is help out there, there's resources out there, but a lot of people don't know that. And so, what we want you to do this morning is just tell us a little bit about you and tell us a lot about Christ Community Health and how it feeds and serves the community in the CSRA.
I would love to, and that is our goal: is to make sure that people know that we are here to serve. We are a nonprofit organization, and our goal is to serve the people of the CSRA with primary health and dental care. So we like all good nonprofits, we have a mission statement, and it says that we declare Jesus Christ as Lord, and we demonstrate his love by providing affordable, quality primary health care to the underserved. So to a patient, we are going to look like high-quality medical and dental offices. Behind the scenes, we have to operate a little differently because, for example, part of my job is to do fundraising. Because to make it work financially for us to serve underserved folks who may not have insurance coverage, we write grants. We take individual donations. We are a federally qualified health center, which means we get some federal funding. But we welcome all people regardless of their insurance coverage. And so that means that we don't limit the number of Medicaid patients that we serve. And those without insurance coverage can pay on a sliding scale based on their household size and income. So we welcome all folks.
That's awesome, Elizabeth. Jackie has something specific you wanted to say?
And she was talking about they welcome everyone, and that leads to who is eligible for service at the Christ community.
So anybody can come regardless of their ability to pay or their insurance coverage. We don't vet people according to insurance coverage. So you could have private insurance through an employer, like I do through Christ Community. I'm a patient at Christ Community. So we do serve people who have insurance coverage. You have Medicare, but you can have Medicaid and you can be uninsured. And we also serve all ages. I want to make sure that that's clear to your listeners as well, that we serve everybody from pediatrics to geriatrics. We do have a pediatric clinic as well.
So that's awesome. Now, this station that you're talking over, Elizabeth, it reaches over 16 counties in the CSRA, that's South Carolina and Augusta. What's your target location that you serve?
And as far as location, in fact, somebody asked me that yesterday if we serve people from South Carolina because we are located in Georgia across the river. But yes, we are open in terms of geography, so it doesn't matter where you live. If you can get to us, we will serve you. And we do, our goal is we placed our clinics in the neighborhoods that we think need us the most, with the hope that people can walk to us if they don't have transportation. And that's great, but the reality is we serve people from over 10 counties. So there are people driving in if they can get to us, Jefferson County, that are, driving in from quite a ways away, that are patients at Christ Community. So there's no limit, and we do have people from Aiken County, Edgefield County, across the river as well.
That's awesome. Now, do you have like sister organizations in other counties in South Carolina or Georgia that may be closer to people?
They're not directly related to us, but there are other what we call federally qualified health centers who they operate similarly in that they accept people without insurance coverage. And there are some, like over in South Carolina in Aiken County, there's rural health services. And I tell you that the reality of it is for folks that are living in more rural areas out in Georgia that are away from the Augusta area, there are not as many services as we would all like. And I believe that's why a lot of those folks are driving into us to get to us, because there's just not a lot available in their counties because it is more rural there. But just to let your folks know, we do have several locations that are Christ Community. So if you lived in the South Augusta area, we have a Peach Orchard Road location that is in with Barney's Pharmacy on Peach Orchard Road. The one that I'm at is on Kelter Street, which is in the Old Town location of downtown Augusta. And then our Peds Clinic and another family medicine clinic are on Datnack Street in the Medical District, so kind of right in the shadow of Piedmont Hospital. So we've got a couple of different locations that hopefully will make it a little bit easier for folks to get to us.
That's awesome.
That's good. So how long have you been treating patients in Augusta?
We started out in 2007, and we're about to celebrate our 18th birthday in November, so we're really excited about that. When we first started, we had 4 people on staff. We had 2 doctors in the Augusta area who had a dream of creating a facility like ours that would treat everybody and reach the underserved in Augusta who maybe weren't getting the health care that they need, or who might have been going to the emergency room to get health care rather than having an emergency, that was where they went for primary care because they just didn't have any options because they didn't have insurance. So at this point, we've gone from those 4 original staff members to 130 people on staff. So we've grown quickly because the need is great. As y'all probably know, there's just a tremendous amount of need, and our hope is to continue to keep growing so that we can serve everybody that needs us.
I tell you, that's awesome, and it's good that I hear you keep saying the underserved, and it's so important that the underserved is reached and given opportunities and options in order to be healthy, and to live a healthy a lifestyle. So if you could give us some of the services that you provide, and also make sure you give the people your point of contact information and how they can get in touch with Christ Community Services.
Yeah, absolutely. So we do have several services that go outside of the realm of just regular family medicine or general practitioners. We have dentistry, which some people do not realize that we have, and that is at our Telfair location. We have what is called integrated behavioral health. It's a really, really cool model where you have people who are tending to mental health issues right on site. So if you came in for a regular checkup and a behavioral health issue like a substance use issue or maybe depression and anxiety came up, we have a behavioral health person right there on the floor that can be brought in to that appointment for a warm handoff, so that you're not saying, well, let's see if we can get you an appointment a couple of weeks with somebody at a different location. It's kind of an immediate need met, so we're really excited about that piece. We do have a little bit of women's health. We have on-site labs at each clinic, which is extremely helpful for our folks who have transportation issues because lab is right there in-house for us. We do cardiac exercise testing, which most people are used to the term stress test. We have the Ryan White program for HIV patients. We do some prescription assistance. We do not have pharmacy in-house, but we help folks get the meds that they need and go through the steps to do that because that's another barrier. They've gotten to us, they've gotten health care, but there may be medications that they need that whose price may be prohibitive, so we help them with that. The Piedmont Mobile Mammogram Unit comes to each of our locations once a month. And I was just talking with some folks at Piedmont yesterday about how in the Augusta area, there are almost no barriers to getting regular mammograms for women, whether or not they have insurance coverage. I mean, that is no longer a problem in this area because everybody's got access. So that's extremely exciting because that's such an important thing. Chronic disease management. A lot of our folks do have chronic issues like diabetes. We have an RN on staff who counsels with those folks on nutrition and what folks need to do to manage that condition. She meets with families for sometimes several hours to go over those details because it's so critical for people with diabetes, for example, to manage that. So there are some services outside of just family medicine that we do. We have a physical therapy clinic that is run by the students and faculty of Augusta University. As part of their learning and training, they come in and treat patients that we refer to them 1 or 2 days a week. So that's really good too. Another bonus for our patients that they may be able to get the physical therapy that they need in-house.
Oh, okay. So how do someone become a patient at Christ Community?
So because the need in Augusta is great, I want to make sure people know that our open slots are limited. So I want, if you don't get us at first, keep trying because I want to make sure that people know that there are slots available, but it is, and you're going to find this in healthcare throughout the CSRA, but particularly for us because we do accept folks that don't have insurance. So what they'll want to do is get established as a patient first before they need us in terms of an illness. Like you're not going to be able to just walk in and get a sick appointment immediately. So what I do is encourage people to call first and ask about getting established as a patient so that they can do the paperwork to do that. And so they can start being seen within the next couple of weeks. They can come for a regular appointment. But I'm going to give you that phone number to call so that they can get that process started. It's 706-922-0600.
Could you
All
give
right.
it one more time, Elizabeth, and also the website?
Yes. So it's 706-922-0600. And the website is a good resource just so they can kind of get a feel for it. A lot of folks will use, there is a contact us, like on a lot of websites, you can send us an email through the website. And if they, for whatever reason, do not, if they didn't get the phone number down and they want to do that, that's fine. We'll point them in the right direction there as well. The website is www.chsaugusta.org. So that stands for Christ Community Health Services Augusta.org.
Okay, guys, I posted that on Get Fit with Jackie Fitness, so you can catch that information there. So it is so much information and resources that is out there, and that's what Coach and I do. We bridge the gap, with our healthcare professionals and other professionals to connect them with the community, to show them what services that is available, what resources are out there, because it's so many people that are in need. It's so many people without insurance. I was somewhere yesterday, and um, haven't had an appointment, and this lady came up, and the woman asked for information, and she was saying, well, I don't have insurance. And of course she was sent through by another health department. And it's like, how many other people out there are going through that with this is so needed. This is wonderful. You guys are doing this, and helping serve the community. I like to say serve, because that's what we are doing. We are here to serve, and if God has given us the resource, the means, the ability, the people, I call it provision, to be able to do what we need to do to serve one another, that's what we're supposed to do. And this is awesome what you're doing. So is there anything else, Miss Elizabeth, that you can share with us, that just right off the top of your head, that you have not shared?
Yeah, I think just the idea about how challenging healthcare is right now. I have insurance coverage, and I've been very blessed with good health, so I don't go to the doctor often. But the times when I've needed to, it has been a challenge. I had a recent, so doing fine, had an issue, went to prompt care, and this was actually before I was employed by Christ Community. And they said, well, if this condition continues, you need to be seen by your primary care doctor. And I thought, well, I don't really have one, so I could do that. I was like, oh, I've got to get established with somebody. And so I tried and got, made an appointment online with the provider. And when I showed up for the appointment, they said, you don't have an appointment, we'll have you on the schedule. And I did it online. And then I went home and ended up talking to them on the phone, and they said, we're not accepting new patients. And so I realized, even with insurance coverage, like it's tough to find a general practitioner. It's just the reality of things. There is a tremendous shortage in Georgia of general practitioners, of family medicine doctors. So I was fortunate to finally find somebody to get on with. And then when I started working for Christ Community, I realized I'm going to become a patient here. This is great quality care, and I'm excited to be able to say, when I go and speak to people, to say, hey, I'm a patient here. I believe in this. I believe in the quality of what we're doing. But it's just the nature of healthcare right now is that it's challenging to find care. And so I imagine people who do not have insurance, who don't have that and are self-pay, that it's just prohibitive. The last time I went to an appointment outside of Christ Community, this was at a prompt care kind of place, my copay was $80.
Wow.
And for some folks, $80 is just not doable. Copay was insurance. So I just sympathize so much for folks that don't know what to do. They need to be seen. They need to have primary care, and they're just in a quandary because they cannot pay out of pocket. The lack of insurance coverage can be for a lot of reasons. There are a lot of folks that are holding down multiple part-time jobs instead of one full-time job to make ends meet, and so they don't get insurance coverage in part-time positions. So we see all kinds of issues that people face, challenges, and there are reasons why they don't have insurance coverage.
You're absolutely right, Elizabeth. Everything you have said is absolutely true. It's hard to even get provide, find a doctor, and a good quality doctor in our in this world today, not just here, everywhere. And so if you have one, thank God, and we're in a place where we got to trust God with our health, but we also trust God, that He give us a doctor and give us health care, doctors that care, really, really care about people health, and see, instead of sick care, but promote well care and not just sick care. But not only you have you're a patient, been a patient, now you are advocate for Christ community. So I hear your passion, I hear your heart, and I have a saying: what comes from the heart reaches the heart. So you're true to this, because I was going to ask you, what is your why? But I think you said it. You already said what's the why. You can hear it in your voice, the passion that you have. So this is great how you guys are serving, how you're serving, and you're committed to it. And this is awesome. I knew about Christ Community, but I didn't know all of this.
Yeah. And you there's a lot of services that you went over, but how many people or patients do you see over the course of a year?
We are at a point where last year we saw over 11,000 folks in
Wow.
the SRA, and that represented 40,000 appointments. So that lets you know that our folks are not coming once a year; they're coming multiple times a year because they need us. But yeah, 11,000 folks in the CSRA. We were their healthcare home last year. So those numbers are so big to me. It makes me realize how much we've grown in just 18 years. That we are providing care for that many people in town. I'm excited about that, and I'm also excited about just the hope of growing and moving forward with that, so that we can reach more folks. Because there's a lot more people than 11,000 out there that need us right now.
That is awesome. 11,000 people is a lot.
That's a lot.
Yeah.
That's a whole lot.
And like you say, there's still more work to do.
But I want to ask, where do the doctors come from? Where you guys doctors come from? Do they work there, or do they come from other hospitals to help?
That's a good question. And a lot of people ask that. So our doctors and our advanced practice practitioners, our nurse practitioners, and our physician assistants, they are on staff with us, and our dentists. So there are clinics that use volunteer power for their medical service. We have a different model where our folks are on staff. And so we are constantly looking for people who can get on board with our mission. And because in order to grow, we got to have more providers, right? And so they've come from a variety of places, but they are, they could go somewhere else and make a whole lot more money, and see patients who have a lot easier situations than what they are going to see at Christ Community. And so, because our folks, a lot of times, they've got a lot going on. Where they come from, they've got a lot of physical issues, but there are a lot of other issues going on in their lives because they do face financial challenges. So when our people come on board with us, they are choosing to serve, and it is just a different kind of, they have to be on board with that mission to represent Jesus through the vehicle of medicine. That faith-based piece, I think, is just so critical, because that's why they do what they do. They see these people as made in the image of God, and they love on them in His for us, and it is beautiful because they signed up for a different kind of life. A lot of them live in the communities where our clinics are, and walk to work because they want to live amongst the people that they serve so they can understand the challenges that they face in those neighborhoods. So that's another piece that I think is very cool.
That is awesome. Guys, if you're out there listening, we're talking with Elizabeth Mary, the Director of Development and Communication of Christ Community. God, and I love it what you said, the doctors, being in line with that mission and that vision, that faith base. They're not only getting physical health need, but they're also getting that spiritual part of it. And that's awesome to serve. I jokingly with my husband, and I told him, and I believe it. I said, I think it's just going to get to a point where we're going to have community hospitals where doctors going to have to go to the people, and setting up clinics in different communities, So I applaud those doctors who is doing that, who is serving. They are looking beyond a paycheck and looking at the service and the need of the people in the underserved community, because it's a lot of underserved people in the community. And so this is phenomenal. I applaud you guys, and keep doing what you are doing in the community. People need to hear this, and that's what we're here for. It matters to help get this information out there to the community.
Elizabeth, now you say you guys are, I'm sorry, go ahead.
Well, I just wanted to say this community is so good and supportive of us. It is just, I have just been in Christ Community for about 2 years, and I'm just blown away by the love and support that we have from the Augusta community. It's beautiful. It really is.
That's awesome. That's awesome. I'm really, I'm here, because like I said, I heard of you guys. I knew you guys did good things, but I didn't know in details of what all you've done. So I'm glad you're here, and I want us to stay connected so we can continue to promote what you guys are doing out there. In the community out there. And like I said, I applaud the doctors, and I pray more doctors come and begin to help. But so, and just like I said, I told my husband, I said, I think we're going to see a fluctuation of community hospitals, in the communities, where doctors going to start going back out. My sister-in-law that stay in Thompson, Alabama, she's a doctor, she's an MD, and she does house visits. She stay in a rural community, and yes, she's old school. She go and visit her patients, and that's when that idea popped in my head. But the community is small; she can do that. But she does. She have her stuff, and they love her dearly, and she goes her house calls, and she does that. But it's a small enough community that she can do that. But she's a family medicine healthcare physician. And this is great, and I just think we're going to start seeing more of that. And we just pray that the doctors, that God has touched their hearts, that see this vision, and to go and just run with this vision of what y'all doing in the community.
Thank you. Thank you so much for just letting people know about us.
Yeah.
That's a lot of what I'm doing. I mean, I'm going out and fundraising, but I want to make sure that the people that need us know about us. So I know Christ Community is fairly well known in the CSRA, but I want everybody to know about us. I want to make sure that those who need us know that we're here.
So, in saying that you are a nonprofit organization, how could the community itself help Christ Community do what they do?
Well, when they go to the website at www.cchsaugusta.org, there is a donate button on there. We have folks that will do a one-time gift online, or they may decide that they want to send us some money every month. They want to support us on a regular basis. We welcome any gift, large or small, because it all goes towards the mission and make sure that people get the health care that they need. So when I fundraise, what I'm doing is I'm trying to bridge that gap between what folks actually pay, that are paying on that sliding scale, and what the care actually costs, because it is, medical care is continue to work behind the scenes to make sure the funding is there to continue to serve those folks.
Okay, so Ms. Elizabeth, what some final comments that you can you want to get out there before we get off the air, because we're coming up towards the end of the broadcast. So we want you to go ahead and reshare the phone number, the website, and any final comments that you have.
Yeah. So the phone number, whether you want to become a patient or you just need some more information about Christ Community, is 706.
Hey, how y'all doing? Pastor? Okay, yeah, come on.
And that website is www.cchsaugusta.org. And I welcome folks to get in touch. If you have any trouble and you just want to send us a message through the website, that will actually, I have an assistant in communications that works with me, and those messages will get to the two of us, and we will point you in the right direction. But we welcome you, whether your insurance coverage is fantastic or whether you do not have insurance coverage, and I just welcome folks to come in and see what this model of medicine looks like. I think that when they walk through the door, immediately from the front desk to the physician, that they will feel just the love of God in the way that we treat folks, and the way that the time that we spend honestly with them. That's one of the big things I noticed, is that I didn't feel like as a patient that I was being issued out after a minute and a half in the room, that my provider was really seeking to understand what my needs were and to learn about me. And that wasn't because I worked at Christ Community. That's the way they treat everybody.
Awesome, 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 guys. And I just want to, on the end note, just keep doing what you're doing, as you continue to serve and in your community and doing things unto God, unto Him. He's going to continue to provide, because whatever He called for, He provide for. And so I think that, it's going to increase even more. I speak that to you guys. It's going to get even more abundant and blessed, because as we see where things are moving and how things are going, it's going to be a greater need. It's going to be a greater need. It's already a great need, but it's going to be a greater need. And so, but God will provide. He won't leave you without. So we thank you for taking the time out this morning with Coach Patrick and I here on Health Matters on WAAW this morning and joining us. We appreciate you. We'll stay connected, and we would love to have you on again to continue to reinforce and put this information out in the community.
Thank you so much for having me, Jackie and Coach. I had a wonderful time talking with you all, and God bless you.
Okay, God bless you as well. You have a wonderful and blessed day. Go on down there, enjoy the arts and the hearts, and get some good old food.
Yes, thank you.
All right, you too. You're welcome. What a great conversation, Coach. That was awesome. And I want to thank our viewers out there who watch us by via social media, Alethea Hudson, Wayne Jameson, and those that are else who watching or who may tune in later to hear this. This is awesome. I like I said, I didn't know. I knew it was there. I knew it was in place, but I did not know they did everything that they did. And just to have doctors, that's rare.
I mean, and it's great to
take the time.
Right.
You got doctors out there that really care.
Right. It's great to bring something to the underserved community, because we know that there are so many health inequities, and they're being addressed.
Right.
And people just have to participate in the programs that are out there. Know that they're out there. Seek them out, and then participate in the programs. There's so many different programs out there for people that are underserved. And a lot of times I find, like the programs we provide in the community to help people with manage or prevent chronic diseases and, monitor their heart rates and things like that. A lot of people, it's hard to get people to participate. You'll get people to sign up for programs, and then they won't follow through, so the programs are out there. I mean, even programs for your children, in schools and things like that. Seek out these programs, and if you need them, then participate.
But you got to realize you can't help someone that's not ready to be helped. True. They got to be ready.
True.
And we sow the seed, we water the seed, but God is the increase.
That's right.
But that doesn't stop us from continue to try to reach.
Oh, we have to stay on the wall.
We have to stay on the wall.
Yeah,
we have to stay on the wall. We got to continue. The assignment doesn't stop. You got to keep going. You got to keep going, until you just reach, continue to do what the assignment God has given you, and He will draw them. He will bring them. At some point, they going to get it. But where they at right now, they can't. They're not ready mentally, wherever behavior stage they're in, they're just not ready. And we have to be okay with that and continue on that assignment and that mission in reaching people and reaching it one by one person at a time, one community at a time.
Right, because you never know when it's going to click. So we thank everybody for tuning in and to Help Matters on this morning. We hope something that was said on this morning encouraged you, impacted your life to make you want to do better, to make you want to be healthier. And that's the thing. We are fearfully and wonderfully made, and God has given us, measures in which that we have to participate in order to take care of ourselves, so we can get to a place of health care and preventive care instead of focusing on sick care.
Amen.
Yeah, we have to get to that point. I just want to remind everybody about the weekly program schedule, so that you can tune in and won't miss these great broadcasts that we have on. Weekly Morning Praise with Minister Deborah Pearson comes on every day, Monday through Friday at 8 a.m. Morning Praise Devotion with Pastor Lester Small comes on Monday through Friday at 10 a.m. And then you have the Afternoon Praise Cafe with Mary Harris Monday through Friday, which comes on at 12 p.m. And then Community Matters with Pastor Lester Small comes on Mondays at 11 a.m. Education Matters with Reginald Forrest on Tuesdays at 11 a.m. Transforming Lives Through the Word with Pastor Michael O'Neill, Thursdays at 11 a.m. Church Matters with Pastor Smalls and Sister Gwen Smalls on Fridays at 11 a.m. And then the Talking It Up Show with Minister Arlene Edwards every Monday through Friday at 3 p.m. And Dinner with the Flock at 5 o'clock every Monday through Friday. So make sure you set your calendars, set your reminders for those programs that are broadcasting throughout the week. So thank you for listening.
Stay tuned also for CMF, Pastor Bush, You Matter, Sean Harris.
Yep, and I was about to get to that.
Yeah. And Elisa G's at 12 a.m. and Tony D at 6 p.m. Guys.
Thank you, Jackie, for catching me on that.
Yes, and I would like to thank you guys for listening to Help Matters here on Shout 94.7 FM, the voice of the gospel truth. Remember, we are here to help you to become a better you that you can be. We always like to leave you with 3 John 2. Beloved, I wish above all things that you may prosper and be in good health, even as your soul prosper. Guys, you go out there and have a great day. It's great weather out there. Go out, but remember, always show and sow an act of kindness, because you never know when that act of kindness may be extended back to you. We love you here at Help Matters, guys, and we will see you next time.
Let's go! Come on, get it up. Cause you tune into the station for your morning motivation to get your education for your health and your spiritual needs. Yeah, strong will to empower people to promote the peace.
Hey, how y'all doing this morning? All right. Get out y'all way.
Hey, hi. Your mask.